So we are very happy to welcome you to a very special edition, the very first of a production that is a full collaboration between four people that you see here on the screen. Those are two organizations based on each side of the Atlantic, two patient organizations, and then myself from Negotiate. And we are very happy to do this production for you on today's Rare Disease Day. You go to the next slide, Julie. Oops, sorry. So the theme at a glance today is unmet patient needs. And you may now think that unmet patient needs and unmet medical needs are the same, but in fact they are not. And this is really at the core of working on transformative care, the core understanding that needs to be in place, that this is not necessarily the same. So to the far left, you see the definition of the medical needs, which is not a surprise to many of those of you who come from pharma. Well, it refers to the gap in medical knowledge, technology, and treatment, and also to a focus on clinical challenges. Whereas the unmet patient needs is different. It goes beyond this. It goes into the gaps that are felt and experienced beyond the molecule itself, in this case, if there is a molecule, and it also is about the patient experience. So there is a gap often, and this is extremely important to be mindful of when we think about new interventions or intervention at all in the space, especially in the rare space. And addressing both is critical for the success of patients. With that, I would like to make sure that you have a proper introductions to my fellow presenters here today. Where did we have the presentation here? Yes, Meredith, do you want to start?
Thank you. Thank you for having us and letting us join this presentation. My name is Meredith Weiss. I am the Executive Director of the Gorlin Syndrome Alliance, and I am the parent to a child who was born with this disease.
And I'm Julie Breneiser. I'm the Associate Executive Director of the Gorlin Syndrome Alliance and a retired physician assistant. I have Gorlin syndrome, as do my 33 and 31-year-old children.
And I am Susanne von Seitzberg from the Danish Lichen Sclerosus Association. I'm the chair of the Lichen Sclerosus Association, and I have lichen sclerosus myself.
My name is Camilla Lauritsen, and I have the pleasure of being with Negotiate, which is a company that basically focus on helping research and development teams in the basic research and commercial space, developing treatment that really meets the unmet patient needs. And this session is a deep dive into the two conditions that you just heard about. And I will start by maybe giving the word to you, Julie, to tell us a little more about Gorlin syndrome and the unmet patient need there.
Thank you. Yes, thanks, Camilla. So Gorlin syndrome is a rare genetic illness that affects about 1 in 27,000 people. It can impact every organ system in the body, and the most prominent manifestations are basal cell carcinomas. Some of us have had over 1,000 in our lifetime, jaw cysts, and the psychological burden of this rare disease, in which we are considered never cancer-free by physicians. The unmet patient burden is lifelong. There's always a big elephant, or since we're at Rare Disease Day, a big zebra in the room. Endpoints in drug development need to reflect the fact that treatments available now are painful and potentially result in permanent scars. Meredith, do you want to share a little more?
Yeah, I think one of the things that is commonly overlooked is the impact on children and families. When children are born with this disease, they often have many different anomalies that need to be addressed surgically in early life. And then they'll also develop these other symptoms of the disease, like jaw cysts, and then again, many basal cell carcinomas. And so many of the kids in our community have had more surgeries than they are years old. And there continues to be really no direction on how to treat these children. And so while there's many drugs that are approved for basal cell carcinomas, they're really not developed with children in mind, or children who have the number of basal cell carcinomas that our children do. So, you know, in my child's early toddler life, I would spend hours every night with a little toothpick trying to treat every single basal cell carcinoma that was growing on her body, because the topical was developed for single basal cell carcinomas, not for hundreds at a time. So the stress over the course of a child's life can really just compound when you're left with no real understanding of how you're supposed to treat this disease.
And how do you two ladies see now the evolvement of the understanding of the unmet patient need versus the unmet medical need? I mean, it sounds extremely cumbersome matter this, and I know also, Julie, you are struggling. So how are these two ends meeting, or are they meeting in Gorlin syndrome?
They're meeting it. That's a relative question. It depends on who you ask, and any folks who are interested in drug development must understand patient burden before they go forging ahead. We welcome the opportunity to share our disease information with anyone who might be interested. And because clinical trial design needs to work around other burdens that the disease community might have. Meredith, do you have anything to add?
Yeah, I think that's true. I mean, there's a real inadequacy in what's available to us because it doesn't really contemplate the overall picture of what the patient is experiencing. When you have this ambiguity around what am I really supposed to be doing to treat my disease, and then you know that other symptoms are going to be coming down the pike, I think there starts to develop a sense of mistrust when you end up being the patient every day and you don't have, or I'm sorry, the expert in your own care, and you don't have real guidance or specifically targeted interventions that can help you alleviate the symptoms that you're experiencing.
Is there anything else you want to add in terms of, I know you're going to talk a little about research that you have been actually spearheading in your organization to address that gap between the two. Is that something you will speak to a little later, maybe?
Sure, that would be fine. We can do that.
Okay, super.
Thank you.
And Sus, back to Europe, where we are based, you and I. Are there issues here as well?
Yeah, there are indeed issues. So thank you very much for having us today. I'm here to talk about lichen sclerosus. It's a chronic autoimmune inflammatory skin condition that primarily affects the genital and anal areas. It causes severe itching, pain, scarring, and can lead to anatomical changes and even an increased cancer risk. Despite this serious impact, LS remains widely unknown. It is underdiagnosed and undertreated. The lack of research and innovation leaves thousands suffering in silence. We urgently need better treatments, more research, and stronger support. In 2018, Global Skin addressed this by making a worldwide LS survey, and in just 18 days, 1,500 patients responded to the survey, and the results were alarming. They reported a severe impact on daily life. They experienced reduced quality of life. They suffer pain and anatomical changes affecting their sexuality, leading to depression and anxiety. Many patients have suicidal thoughts due to daily pain, isolation, and lack of medical support. Doctors claim that LS is not life-threatening, but for some patients it truly is. Doctors say the standard of care is accessible and effective, but patients disagree. The most prescribed treatment, clobetasol, is the least effective because only half of the patients see improvement, and it does not last long. The anatomical changes are not cannot be turned back into normal. So in our opinion, patients deserve better care, and we need a game changer in this area. Because the severely underdiagnosed disease, many patients suffering for years, we have on average a 5-year delay in diagnosis, and too little funding goes into LS research. But here's the good news, because patients are more than willing to participate in research. A lot of patients are willing to undergo biopsies to help drive new discoveries, and they are open for new treatments, even if it is topical solutions or systemic therapies or all between that. So this is a huge opportunity for breakthrough research, but we need your support. So if you are a researcher, LS is a wide open field with enormous potential for meaningful impact on these patients. If you are a medical professional, patients need better diagnosis, better care, and better treatment options. If you are a funding organization, your support for LS research and innovation could lead to life-changing treatments. And if you are a pharmaceutical industry, patients are ready for clinical trials. So LS is more than just an inconvenience. It destroys relationships, it destroys families, it destroys mental health and physical well-being. We see parents have been wrongly accused of abuse due to LS symptoms in their children. We see couples break apart due to lost intimacy, and people withdraw from life due to unbearable pain. So we need early diagnosis, better treatments, and ultimately we need a cure. So we have the patients, but we need the research. So please help us.
Thank you so much, ladies. I am sure, and I also hope that people watching this can appreciate the urgency, that they can appreciate the difference between unmet patient need and unmet medical need, and that they can appreciate the extreme importance of understanding this in combination with that urgency that all of you have outlined. So with that, I hope we have done a little dent into making sure that something is going to happen. At least you have done a phenomenal work, ladies. Thank you so much for joining on this session, and we look forward to working with you going forward to change things and status quo.
Thank you.
Thank you
Thank
so
you.
much.